Hi, can you listen to me clearly?
Yes, I can hear you.
Yes, that's good. Please give
Please give
me
me
a second.
a second. Okay.
Yes. Let me share the. Yes. Can you listen to me?
Yes.
Yes. So, from the class of yesterday, did you check the apples that I sent you?
Yes.
Do you have any doubt, something you would like to work on?
Um. Yes. I think the concepts of illness and sickness, I didn't got it too much because are so um they look like the same.
They look like the same, right?
Mhm.
Can you watch the purple one, right?
What? I'm sorry.
The screen. I'm sharing
Yes, I can.
a presentation now.
Yes, I can see the presentation.
Yeah. Well, you were asking about the definition, the healthness and illness. Well, give me a second, please. I like to check the sound. I have 1 minute
Okay.
more. Mm. Now, is that okay? Can you listen again? The cycle
Yes.
sound. I don't know what's going on. Mm. Yes. Now, can you listen to me again?
Yes.
This is not working in the way I was expecting for.
Maybe it's because you're with two devices.
I don't know what's going on. Yesterday it was working so good.
Mm-hmm.
Now, is that okay? Yes, it's better.
Yes.
Let's share. Well, you were asking me about the definitions of health and illness. And now we are going to check it again, okay?
Okay.
So let me open the presentation from yesterday, and then I could talk about it clearly. Yes, let me share this one. Yes. Now it's better about the definition of healthness and illness. This one, right? Is that okay? Are you there? Hello?
Yes, I can see the presentation.
Yes. Maria Fernanda, right? Are you there?
Hi, yeah.
Hi, Maria. I'm sorry. This is a workshop. This is just a moment I can talk with each student. And yesterday I was explaining this.
Yeah, sorry, I couldn't be here yesterday.
Okay, I have 12 students on list, so you could be the 13th. But now it's not at the moment. So please, I will call you later on. Please give me the chance.
Okay, so do I like leave the room?
I'm sorry.
The meeting? Do I have to leave the meeting?
Please, just for this moment, I'm going to send you a WhatsApp by internal message.
Okay.
And I'll tell you around the time
Yeah.
you're going to get inside, right?
Okay, no problem.
Okay, thank you so much.
Bye.
Okay, let's check the illness, sickness, and disease, right? I'm sorry for the time. I promise it's not going to happen again.
Okay, don't worry.
Okay, illness, as we said, is the presence of a specific disease. For example, I don't know, let me think something to be extremely clear. I mean, you're in the first year of career, right?
Yes.
Yes. Well, when you have a specific disease like, I mean, coronavirus, just the one that is on top. And that coronavirus is going to take some time to get solved. I mean, this is a specific disease that we can diagnose by lab tests, by clinical tests, and it takes the individual perceptions. I mean, psychologically, the patients know that it's coronavirus. Is that okay until now, till this part?
Yes.
So in the way the patients know it has coronavirus, the patients gets more psychological and physiological, well, in problem, I mean, right? But its illness, it's not going to be for the rest of it, of all the life. I mean, it's going to be for a few days, and with treatment, we know it has a cure. Is that okay?
Yes. I think I got it. So I think that's all.
I'm sorry.
I understand now. I think I can get the difference.
Okay, you got
between
now the concept,
illness, disease, and
the
sickness.
idea.
Yes, I got the concept.
Perfect. Disease, is that okay?
Yes.
Is for example, when you got cancer, I mean, it's a disease, something that is going to take more time in the timeline, I mean, and then it's harder to solve. Is that okay?
Okay. Yes.
And sickness is the individual situation, or that symptoms that an individual feels. It's a dysfunction, I mean, but it's like symptoms more than of signs, or more than a lab test that could give us a response. Is that okay?
Yes.
That's great. Well, I was preparing some material to share with you, with all the class, in this workshop specifically, because the idea is to practice all the things we were doing yesterday. When we talk about health and illness, just for getting an idea, not just the difference, in the book we got with the institution is, if you are in a good health, you are well and have no illness. That's something clear. But if you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. That was the topic I was showing you with the healthness and continuous. Do you remember that topic?
Yes.
that I was showing you, the cross line?
Yes.
This one.
Yes, I remember.
Yeah, that's good. So for not ill, fit and well, healthy, fit, very well or well, in a good health, is the opposite of ill, unhealthy, unfit, unwell, not very well, poorly, in poor health. That's just the support of this image. That's the all. And the all topics of understanding those globes, those circles are explained clearly in these charts. But it's just for getting in knowledge, for understanding that that's the difference. The most important difference is the three topics: sickness, illness, and disease. Asking for health and illness, that would be great. At home, you find 5 ways to ask about health and illness, taking an idea from the questions that I sent you yesterday. And it's important because in the test, I'm going to ask about the difference between recovering, improving, deteriorating, relapse, and remission. Is there any doubt about these definitions?
And no,
Okay. When we talk about the parts of the body, we have to understand the limb that it's obviously the upper limbs and the lower limbs, the trunk, that can help us to talk with doctors. When we ask for about it, we ask about, I have trouble with my hip, shoulder, or doctor could ask, do you get any pain in the chest, in your back, in your stomach, in the stomach, in a more general or more specific way, but trying to find the exactly words to get the information we are asking for. So the patient describes a gradation of the pain. For example, it starts in the back, then it seems to go into the right buttock and down to the back of the right thigh to the knee, things like that. So I mean that we have to get the correct verbs to describe the position, the movement, the radiation, and then also the bowel or the intestine are the same. The small intestine, the small bowel. That's just for information. In the graphic of men, this is the homework to, well, but it would be better if we, oh, I'm sorry, are you watching the purple? Oh my God, this one. Fabiola, are you there?
yes, the presentation is talking on the part of illness, wellness continuum.
It's still there, ratios. It should be here. Now it's the men, right? No. What's going on with this? Ciao. I don't know what's going on with this. This one. Now, can you see the man? It's supposed to be shared. What's happening with this?
Yes.
I don't know what's happening with my computer now. No. Now, can you check a new presentation? Yes. Ren. I was telling you.
Yes, now I can see the presentation.
I'm sorry. I don't know what's going on with that computer. It's getting crazy. For about 2 weeks ago, I have to check it as soon as possible. Now, yes, I mean, is that okay? Can you tell me which imagine are you watching, please?
Yes. First were body parts, but now I think the presentation is just passing.
Yeah. Give me a minute, please.
Now is in asking for health and illness.
Yeah, thank you. Because it's too slow. The illness now asking for health and illness, right? It was okay.
Yes, the presentation is now there.
Yes. that was how I was talking about limbs and the referring parts of the body, how patients give you information and how it's possible to get a question. Do you get any pain in the chest, in your back, in your stomach? I mean, something general or something specific. But, well, so, and the describing of the radiation of pain. That's all. That's the way the pain is moving, just for checking the verbs that we could use for describing or talking in that way. And the sign of vowel and intestine, the small vowel or the small intestine or the large intestine, the large vowel. Or for example, the anus and the rectums are called back passage because of the position, I mean. And then talking about the parts of the body, we have our male model without the names here because I consider it could be the homework that I'm going to send to the group. Okay, we are going to tell you tomorrow when it's going to be checked, okay? And just for checking,
Okay.
do you have any doubt about it? Because there are many words that in the way I told you are in Latin. For example, the oris, the umbilicus. That's okay, that's interesting. In grammar English, they still use the Latin. It's not the same as in Spanish. That's why it's just information that we should know, because it's the same that when colleagues from foreign speaking English language tell us in Latin or in Spanish, and could be a little confusing. While we go through the classes, going to specific systems or specific organs, we are going to get it into in a deep way to get into with more details. This is just an introduction. Talking about the cavities, abdominal, anterior and posterior cavities. Do you have any doubts?
No.
Okay. About the internal organs, any doubt, something you would like to check? Vocabulary, something that is not in the way, okay. With abdomen the same. With sometimes many words are written and the same as in Spanish. From here, there is no doubt, I mean, right?
Right.
Okay. That's best. Talking about body functions, do you have any doubt? Something you would like to check?
No, I got it.
Okay, that's great. That's not something different, that could be considered difficult, right?
Yes.
To ask about it. When taking a history, we as a doctors ask, do you have any trouble, difficulty, problems, or maybe pain? And then is when the body functions get into the practice or the practical use. Do you have any difficulty breathing, passing urine, or in the way it's written here, do you have inhaling, exhaling, breathing, taking a breath in, breathing out, passing water? It depends too much in the way and the confidence the patient got on you. Is that okay?
Yes.
And about the 5 senses, I think that this chart is clear, but if there is any doubt, I'm here for you.
No. No, any doubt.
Okay, practice makes progress. That's all in talking about medical English. In the way, this is the first the first one we are talking about. It's not not something so hard, so confusing. Later it's going to be a little harder. Okay, it's great if it's okay, because that's the way we can work on, right? Okay, so that's all between us. I'm going to wait for the next one.
Okay, thank you. See you tomorrow. Good night.
See you tomorrow. Good night. Thank you for being so punctual. That's the best. Well, there is no milking. Let's listen to some music. Well, this is going to be recorded. So number 2 in my list is Belkin lies. I'm waiting for 3 minutes more. If you can't get inside, please. Ruth de Maria, get into the class, please. Please all be on attention. The same. Who's inside? Na, 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 na. It's free for getting into. Well, 15 minutes left. Hi, Belkin and Ruth. Hi, can you listen to me? Hi, is that okay? Can you listen to me? Belkin?
Hi.
Ruth, hi.
Yes, I'm listening to you,
Okay.
but I don't know if I'm going to wait
Well, Belkin just have 5 minutes.
for Belkis or
Well,
I don't know what is happening.
we have
Ah,
the
okay.
we have exactly time. Belkin, can you listen to me? Diana
Hi.
is later.
Good
Hi,
evening.
Belkin. Is everything okay?
Hi.
Ruth,
Yeah,
if it's okay with you, for me, there's no trouble to work with you too. For me, it's okay, but it depends on you too. Is that okay? Or Belkin, if you want, you can wait for me in the last part. Is that okay?
there is no problem.
Stay. Ruth, is that okay
Yeah.
for you to stay? Because now Ruth is just almost your time.
It's okay for me.
Okay. Alexandra. Tola. Oh, well, she left. Well, tell me, do you have any doubt about the session from yesterday? Something that you want to talk about? Something that could be different? Something that is calling your attention?
Well, I think the illness and the disease.
The difference between that, okay. Give me a second to share my screen with that presentation.
Yes, but I understand that it's the differentiations of disease and sickness, but with illness, I think it's almost the same like sickness.
Yes, they are almost the same. But the difference is the way of the proof we can show about it.
Yes, but I understand the symptoms and the signs. But with illness, I think it's almost the same like sickness.
Yeah. Yes, it's almost the same. For example, ¿dónde estamos? Give me a second, please. I'm going to share the screen. About this one, right? It's going to be on. Yes. Can you see the diapo, the presentation? Illness, disease, and sickness.
Yeah.
Yes.
Yes.
I think that this is the most confusing part of the understanding line, because in the way they are almost the same in English, in Spanish they get us in confusing. Illness is that situation that we can prove with lab tests, with signs and symptoms. When the subjective state of the person feels so well and not be well, feels so bad. For example, I mean, in coronavirus, I mean, there's the presence of a specific disease, but a disease that could be shown by the patient. Then the perception and the behavior are the response of the disease. I mean, in the coronavirus, you feel the fever and you look bad, you have a bad aspect. I mean, the impact of the disease, the impact of the disease is in the psychological environment. You feel bad, and the patient thinks that everything is going to be in a bad way. On the other hand, the disease is something that is wrong in function, but it's not something that is going to be shown every time, all the time. For example, a cancer, I mean. And then the physiological and the psychological dysfunctions are together. Is that okay? There's the little difference. That's the fine line that we have to check. And the sickness is how the patient feels about it. Is that okay? Or it's not clear?
Yes, thank you.
Did you
It's
understand it,
more
or
clear.
maybe in another way?
It's more clear for me. Thank you.
Okay, that's great. So, any other doubt? I mean, something more you would like to check specifically, or maybe we can see something that I've been preparing. Yeah. When we talk about the workshop, I mean, we might consider the way we are working. This. So, I'm going to open another check. This. Can you see the new screen, a purple one?
No.
I'm sorry. Ahora sí, that's okay. In the workshop,
Yes.
the principal idea is to get a little bit of vocabulary, I mean, and to get more clear a few details. For example, this is just one example in the way we are working on. In health and illness, when you are healthy, fit and well, fit very well or well, in a good health, you are not ill. That's obviously. That's why if you are in a good health, you are well and have no illness. We have no disease. But if you are healthy, you are normally. You are well and you can resist illness. But if you are fit, you are well and strong. That's our definitions that can help you to understand patients while talking. If a patient tells you, I'm fit, it means that he's well and strong. I'm ill, saying just ill, you can think about many, many ways of being not healthy. That's just the situation. That's just for being a little clear. And for homework, I'm going to send you tomorrow night is going to be ways of asking about health and illness, and it's just for being creative, but creative in the way of the health providers, being clear, trying to get the topic inside. And it's important to get the difference between recovered, improving, deteriorating, relapse, remission. Is there any doubt about them?
Yeah. I am a doctor.
Yes. Is that okay, Ruth? Everything okay?
Yes, all is okay.
Okay. So talking about limbs, upper limbs, lower limbs, well, we are doctors, we know this. And we have to understand that there are many synonyms. Limb, just a patient could say, hurt my limb, but which one? With my upper limb or my lower limb? The trunk, it's excluded from the head and limbs, just the trunk. Well, we know what we are referring for. Referring to the parts of the body, patients usually say, I'm having trouble with my, and then continue with a part of the body that could be with a scientific way or in a common way. I mean, with our male model. Here we have definitions in Latin, for example, oris, in English in the social way of describing the forearm, for example, the armpit or the axilla, or maybe axillary. It depends on how the patient is talking to you. Is that okay until there? Hi. And then
Hi.
we have ways to ask for. For example, do you get any pain in the chest, in your stomach, in the stomach, being some general way, or pain in your more detailed, more specific place or more specific situation. Is that okay?
Can you
Yes,
repeat
it's
this?
okay.
Yeah. When we refer to the parts of the body, we talk about the upper limb and the lower limb, and we have to say that patients usually tell us, I'm having trouble with my hip, shoulder, knee in a specific way, or maybe pointing that place that is hurting. And it could be necessarily to ask in a specific way. Do you get any pain in the chest, for example? Do you get any pain in the hip, in your shoulder? Not just a huge area, just a specific point. That are ways that we can ask for information, but it's not the only way of doing that. Is that okay?
Okay.
Yes, it's okay.
Even while describing the radiation of pain, we have some verbs that we have to remember. Patients usually says it starts in the back, then it seems to go into the right buttock and down the back of the right, or here tied to the knee. They are, with this part, I'm showing you a little description that patients give to us. And we have to be with an open mind idea that they could use these words to maybe it starts here and then moves there and then goes back and then goes down. And we have to try to order the ideas, getting the correct verbs. The ones that are in black starts in, go into, down, moves down, radiates. It depends on the patients, how they describe and how we ask for it. Is that okay?
Yeah.
On the other hand, when we talk about the parts of the body, we don't use always all the time the scientific or the technical definition or word. We use synonyms too. For example, to say intestine, we say bowel too. The small intestine or the small bowel, the large intestine or the large bowel. That kind of synonyms we are going to study while we are going into the specific systems, while we are going through the course. This is just an introduction for having an idea that it's a good point to understand that we can use many kind of words that could be more technician, could be maybe in Latin, or could be maybe in the social way of asking for. Is that okay?
Okay.
Yeah, it's okay.
Okay. Our male model, this is the most complete chart I could find because it has the three ways of calling: in Latin, in the social way, in the scientific way, in the technical way. With the carpus in Latin, wrist for the social media, and the carpal for the technical way of talking. And it repeats from many parts of the body. The umbilicus in Latin, navel for many people in the frames, and umbilical for technician. So we are going to work on this slowly. It's a little confusing at the beginning. About the cavities in the body, do you have any trouble? The ventral cavities and the dorsal ones? Rose, maybe?
No,
Belkin, is that
no,
okay?
probably no. I
Thank you.
understand
How about the parts of the body in chest, in
the
thorax?
cavities.
Is there any doubt about them?
No.
No,
It's just reading. In the way we are in the medical profession, we know all of it. I mean, it's just for reading, just for getting in mind. Yeah, there are too much images. About the body functions that we are talking yesterday. Anything that could be confusing, I mean? No, is everything okay with that part?
Yeah.
yes,
About the vocabulary we have here, everything's okay, I mean.
yes,
About body functions that are in this chart, this is just an example with 6 functions, but of course we have more. This chart is going to help us to construct a kind of this one for practicing, but we are going to make it slowly while we are going. How to ask about the body functions? Do you have any trouble walking? Do you have any difficulty walking? Do you have any problems passing urine? Do you have any pain when you breathe in, when you move your leg, when you move your joint? Is that okay? That's a grammar key for helping to ask in a good way, in the correct way. Is that okay?
Yeah.
Can you listen to me
yes,
clearly?
it's okay.
Sometimes.
And there is better. So I'm going to bring a microphone if that is the trouble. Even the 5 senses with this chart are going to help us to construct this kind of chart in order to practice. Is that okay? I mean,
Yeah.
any problem with this chart?
No.
No? Everything
No.
clear?
No.
Okay, and you, Belkin? Ruth, I mean?
No.
Okay. Okay, practice makes progress. So we have to practice a lot.
Yes.
Okay. So that's all I think. Anything you want to ask for?
No.
Anything you get, anything you need to get in clear?
PowerPoint.
Right?
You will share this PowerPoint with us.
Do you want the presentation?
Yeah.
Just finally, while finishing, I can send it to the group. There is no problem.
Okay, thank you.
Okay. So don't worry, I'm going to check who's the next.
The homework
I'm
that
going to
you
send,
gave us
I'm going to
is
send it
for
tomorrow for the next
or
week.
you're gonna give us tomorrow?
Yeah, just
Oh.
tomorrow, please. And then we are going to talk about it tomorrow. We're going to have more time about it. Is that okay?
Okay.
Okay. So see you later. See you tomorrow. Thank you so much, Belkin and Ruth. It's nice to work with you. I'm meeting you. I promise I'm not being checking my list all the time. I have to learn your names now. We have to meet each other.
Okay, thank you. See you tomorrow.
See you tomorrow.
Bye-bye.
Bye. Fourth one. Johan, you are the fourth one. Hi,
Yes,
Johan. Are you
hello.
there? Hi, Johan. How are you?
I'm good, thank you for asking.
Yes.
What about you?
Well, tired as always, but that's no new. Well, do you have any specific question to talk about?
This is the only way to progress.
No, don't worry.
Actually, I didn't study enough to have questions. I'm sorry for that. I
No.
apologize. I was too busy today. And yesterday, I really liked the course because I
Yeah.
saw that it's so professional, and it's like with people like everybody is doctor or student. So
No,
I really
don't
like
worry.
that. And no, I'm gonna try to study more, and of course I'm still learning. I know that and actually I'm still learning English, and because I didn't go to a bilingual school, so I have been learning English since I was a teenager, I think, and
That's great.
I'm still in class.
No, don't worry. It doesn't matter if you read or study the presentation I sent you yesterday. That was just a way for improving our way of talking. I mean, can you listen to me clearly? Because my connection is
Yeah, sometimes it's freeze, but sometimes it's okay. Right now I can hear you clearly.
perfect. So don't worry if there is anything that you want to ask for by WhatsApp, I mean, or something like that. There's no problem with me. We can talk it
Thank
later.
you.
And I sent you the presentation yesterday. I think I'm going to do it this week because I understood that the institution didn't give you the material for studying. And it's strange because
Yeah, they
if
didn't
you
give
don't
it.
have
I don't
where
know.
to study from, it's harder for you to get into the class. So what's our north? I mean,
Yeah, I don't know if in the future we're gonna get it. I don't know if they are gonna send it or not.
I'm going to ask about it again, and
Yeah,
with the response I'm going
and
to show you.
and I have some questions, but it is about your profession. It's about, I don't know, because you have a really good fluency and accent. I don't know if you study in another country like
Yeah.
England or the US.
No, I studied in Cuba, as I told you yesterday. I got my career in the Caribbean, but one specific advantage I could find there is that we get English for 5 years to the social media and then the medical English specifically. That's why I consider the institution chose me for giving this course and the workshop. And moreover, here in Bolivia, I was working with many tourists and many foreign American patients in many private spaces, I think.
And have you ever thought about go to another country, to like England or the US,
Maybe
to get
the US, but
a specialty?
yes, I would like, but now it's
You're
not
still
time for
young.
doing that. When I was in Cuba, I had many friends from Honduras. That's why I remember them with so much love.
Really?
And they're amazing people. And I had the
Really
opportunity to
nice.
practice with them English and to practice many things. They were trying to teach me Garifuna. I didn't understand any word.
Garifuna.
Yes, and that's amazing. I remember your relatives, your
Garifuna and Miquito.
paisanos with so much love. I know that people from your country is very interested in the topics are studying, and that's great to have a colleague. So you are going well, you're doing your best, and that's the best way. So yesterday, while the class I was teaching you, I was showing you the the most common topics about talking in this introduction part, because this course, I understand, is created for doctors. Now it's so easy, it looks extremely superficial, but in the way we are going into the classes, we're going to find the differences between external, internal, and specific diseases, a specific way of asking for, a specific way of informing, of giving bad news, good news, recovering patients, to understand the charts of scores and many things for talking about specifically health and body functions. Now it's just a site in general we are going to watch. That was I thought. I was sure that everybody was doctor, but you are in the last year in the social service, I mean, right? I remember what you told me yesterday. You are in province.
What?
You are in your social service.
Yeah. Yeah, in my social service right now. It's the last year. I don't know how many years you do. I think it's like 6 years in Cuba to be a doctor. Here is 8 years. Now it's like 7.5, but sometimes it takes like 8 or 9 years, because sometimes we lose classes because the manifestations and problems of the country. And sometimes I think people that go to Cuba to study from Honduras is because sometimes we have to get an exam over here, exam that is really like heavy. It's like something that you have to study so much. Thank God I passed. I don't know how, actually. Thank God for that.
Yeah.
But if you want to be a doctor, you can go to Cuba, and I heard that Cuba has a lot of benefits to doctors, and it's a really good country to study medicine. Actually, I thought about it because I started to study another career. It wasn't medicine. I was studying electric engineer. So and then I changed.
But engineering careers are so hard too. One of my sisters is a civil engineer, and I understand it. It's not easy. She left.
Yeah, but actually,
but tell me, I'm listening to you. No, she finished. And not left. I got confused. She finished her career in about 8 years. It's so long.
No, yeah, and actually, I had good grades when I was in engineering, but I didn't like it. Like, I don't know. I feel that medicine is like better. It was a challenge for me, and I took it.
Yeah, but that's interesting, changing from engineer to medicine. They are so different worlds on the opposite completely. The opposite in all ways. But if you feel good in this career, well, colleague, just one step more, and then you're going to be with
working
everything.
For free.
Yeah, you are in a good moment. How old are you? I mean, I'm sorry for asking this.
I'm gonna put the speaker because my headphones doesn't work.
Hi, Johan. Can you listen to me? Is that okay? Your connection?
Yes, I can.
My connection for a little moment tends to fail.
Yeah, you are in Bolivia, right?
Yeah.
And can you tell me why? I don't know if I can, if you can tell me, of course. Why do you study in Cuba and not in your country?
Well, when I finished the school, the secondary school, I got a scholarship because, well, it was not the scholarship that I was looking for. It was an accident, the way I got it, because I see the promotion on TV. And then I said, why not? Just for having fun. I never thought that it would be a way of my life. when the Cuban embassy called me for going to the interview and taking the test for checking if I was in the correct way of going, and I passed all the tests, I couldn't believe that. So I said, why not? Let's take this opportunity because it's not going to be again. And I decided to travel,
It was
to go
really
another
good.
country with a full scholarship. In Cuba, I received everything. I didn't buy anything from my career, no material, no books. Everything the
Nice.
Republic of Cuba gives to the students, and the students are the responsible about it. For example, if you are in the first year, you receive all the books from the first year. While finishing for taking the final test, you have to get back the books to the university, and then you can go to your test.
Nice.
That's an interesting
Nice.
system. Yes, sometimes, well, with many assignments, many careers in Cuba, that's the way of studying. You share the material with the ones that are coming back to you. For example, my books from first years are for the students that are going to be there. That's why I have to take care of them. I have to respect them and control their material. And
Nice.
in
It's a really
the,
good.
yes, because you don't have to get too much money on books. When in the way I was, well, in that scholarship, I had the opportunity to buy my own books because they told us, if you want to buy your package of books each year, you can do it by this amount that was so cheaper comparing the prices from Cuba to Bolivia.
Nice.
The
Really,
difference
really
is amazing. So I brought almost all my libraries. It's from there.
Oh, your life.
Yes,
Yeah,
this is a
nice.
part. Another part is in another place.
It's a
So
lot of books. I have some questions about this course. I don't know if we're gonna have some homeworks like essays or like
yes,
paragraph or something, because I want to write, because
yes,
it's
I'm
the only
going
way
to
to
send you
practice your
certainly.
reading.
Yes, I'm going to certainly to send you the tomorrow night for sending me to the next week, because it's going to be a little longer. But I need you to give you the class tomorrow for you to understand me. If I send you now, it's going to be a little confusing because there is a specific vocabulary that I need you to start practicing. Vocabulary that we are going to use in the rest of the classes.
And for you, is the same that you attend a patient in English or Spanish?
Like, the same symptoms, the same ways of asking. In Spanish, we have the disadvantage that we have many ganjas. We can change the words depending on the place you are. In English, it's a direct communication, but these communications could be confusing because of the way of the verbs you use. That's why you have to know and you have to understand that it's the most important part to get to know the correct verb of asking for or giving information, for not going in the bad interpretation of the patient. If I didn't get medical English while being in Cuba, certainly I would take this course. I would do it. I would.
It's a nice opportunity.
Yeah.
And actually it was cheap. If you think about it, and if you search courses in internet, you're gonna see that it's like sometimes it's more expensive.
Yeah.
Nice. And
that's a good course. I mean, when we were talking with the administratives, with the superiors, they told me about the opportunity of teaching, and I said, yes, why not? I did it when I was at the university. I did it here in Bolivia. Why not?
Really?
And it's amazing because
you were a teacher when you were in Cuba.
yeah, there you have, depending on your
And how was your
records.
life? How was your life in where was your life in Cuba? About, did you miss your family? Did you have all the things, stuff, food, things that you need? And
It's
how
hard.
how did you feel?
It's hard, so hard. It's different. Cuba is a small world into the real world. It's it's a complete different reality.
Were you happy in Cuba?
Well, first year, first and second, it was so hard to get used to get used to environment, the people, the customs, because when I was there, I was with the old program of studies with like everybody, every place, anatomy, physiology, embryology. The topics were different from now. Now Cuba has another way of studying that integrates all these systems, and I really don't like that. But I'm happy that
I
I
heard
was
that.
there in that moment. So I finished university 10 years ago. Then
Yeah.
7 years of preparation. In Cuba, 6 years of medicine and 1 year of pre-medical course. So you are 7 years living there. This
Yes.
first year is like getting everybody in at the same level with the secondary basic knowledge. If you don't pass the pre-medical course, you can't get into the career. When you get into the career, everybody in the same level as Cubans, then you can go into and to go through everything. The way I was living was with families. I was a little time in an internado. I don't know how to say that. That's a word.
Internship, I think.
I was living in a building with all of my relatives from Bolivia. Well, I don't know, from Honduras, from Nicaragua, from many parts of the world. But the most were from Central America. That was my group, yeah.
Central America.
Yes.
Nice.
Nice people.
You have to go to Bay Island. You have to go to Bay Island.
Yeah. So when we finished that first year of preparation, we were sent to our hospitals in different provinces. And then while being in provinces, we have just one rule: pass the course. If you didn't pass, you are again sending back to home. That was a scholarship. You have a time to pass. You are not going to spend the Cubans' money without studying. That's the only job you have.
That's so sad. I don't know if you traveled and then they tell you that you have to return because you don't have. I think it's so
Many
sad.
things we could be talking. That's okay. I can tell you that's interesting. That's a different kind of world.
Yeah, I really good.
So Johan, I'm sorry, there are 15 minutes left. I have to continue. Now it's time
Okay,
for Claudia.
bye-bye. It was a pleasure.
Please check the material that I sent you yesterday. And because from there it's going to be the homework and the things from that I'm going to send you tomorrow. Is that okay?
Okay, thank you.
Okay.
Bye-bye. Thank
See
you.
you tomorrow. Bye.
See you.
Hi, Claudia. Are you there, Claudia? Oh, you are connected.
Hi,
Hi, Claudia. I'm sorry, I'm 3 minutes late.
it's okay.
I think you were listening to my speech. I'm sorry.
Not really, I was working.
Oh, I'm sorry, Claudia. Well, in the way I was telling you, I talked to the superiors and we were talking about your situation. And that's okay if you get into the class in another time. Is that okay for you? There's
Yeah,
no
sure.
problem with me, but I think that if you have any doubt, we can chat in another moment, or maybe by mail, by WhatsApp. I don't know. There are many ways of communication now.
Okay.
From yesterday, do you have any doubt specifically?
Maybe just some pronunciation,
Yeah, that's great.
like, let me see. There was a word like urination.
Okay, I mean,
Me
from
too,
the chart of body
like that.
functions, right? Let me share you the screen and tell me if I'm okay. Is that okay? Can you see my screen? A black one? I don't know what I did.
Word micturitation, I think, I guess. I don't know.
Ah, okay, you see. Let me open this. Micturate.
Micturate.
Yeah, micturate. Yeah. Urinate, micturate. Is that okay?
Yes.
Urination, micturition.
Micturation.
Is that okay? Inhale, exhale, breathe in, take a breath. Is that okay? Hello, Claudia. I can listen to you, Claudia. Ah, yes, that's okay.
Gate or step.
Okay. Pass urine, maybe. Pass water. I'm sorry. Mute. Okay. I'm sorry, can't hear you.
In that other word, gate.
Yes. Now I can
how-
hear you.
Is that okay? Gate.
Yes, I have a cycle sound, but I can understand you. I don't know anything, for example, pass feces, pass stools. Is that okay? Hi, can you listen to me?
Yes.
Oh, Claudia, I can hear you so good.
Wait a minute.
No,
What about now?
I'm sorry.
What about now? Can you hear me?
The nouns, okay. ¿Dónde estamos? ¿Dónde estamos? Ay, I lost my pointer. You see, I lost my pointer. Ahora sí apareció. Well, nouns. Speaking, speak, and speech. Walk, gait, and step. Inhale, exhale, the breath. Is that okay?
Yes.
Urinate, micturate, pass urine, pass water, urine. Just that, urine. Defecate, pass feces, pass stools, feces and stools. Just. About menstruate, have a period. We have a menstrual, we have monthly, or just period. That's all. Because we still have uterus.
That's okay. I don't have any more questions.
Okay, about the contents, something that is not clear from yesterday. Something that you would like to check. Okay, many of your classmates were asking for the difference between, yes, between illness, disease, and sickness. Is that clear? I mean, if I ask you in a test now, yeah, could you tell me the difference between them? Is that okay? Because I'm sorry, you are without your microphone. Hi, Claudia. Oh, no, I can hear you. Is that okay? Is it clear?
Maybe you can explain me a little bit more about the difference, please.
Yes, that's okay. When we talk about illness, disease, and sickness, we might understand that even if in Spanish it's the same word, in English it takes a different way of interpretation. Illness is the presence of a specific disease. I mean, something that we can prove by lab tests, by X-rays, by imaging studies. I mean, that's something that is inside the body, and the individual, the patient, have a perception, have a change in behavior, and have a response in body that can make a huge impact in the psychological and physiological environment. This is a subjective state of the person, and that's a physical weight of feeling. I mean, like coronavirus, for example, when a patient gets the diagnosis, instantly get depressed, and the symptoms and signs are rising. I mean, are worse. Is that okay for that? Talking about disease is something that is wrong in the body function specifically. It's a psychological and physiological dysfunction. I mean, for example, when you get a cancer, you can, something is wrong, but deeply wrong, working in a bad way, but it's not easy to see in the first sight. I mean, is that okay? When you don't see it in the first sight, when you can check a patient that look normal, but it has a terminal situation, even that the patient don't know, that's a disease that could be difficult to cure, or could be take more time to cure than an illness. An illness have a time, or not long, not too much time for being. A disease could be years and years in body. And sickness is just the perception of the pain of the patient. It's just the symptom that the patient can describe to us. Is that okay? I'm sorry, I can't hear you. You are without your microphone.
Yes, I got it.
Yeah.
I heard a long time ago that illness was like when someone was like really, really sick, maybe like almost dying. I don't know if that's correct or.
Well, in the checking, the documents I was checking, I was reading, that was the opposite. The disease was the deeply wrong situation, not for dying at that moment, but a situation that could be harder to solve than an illness. An illness, it's a delicate situation. It's a delicate moment. It's a specific disease. I mean, but it's
Like
not
something
that way.
Agudo, I don't know how to say that. Acute.
No, acute. Agudo, it goes to acute. Chronic, chronic way. Something chronic is a disease. Agudo could be an illness. Sickness is the disease, yeah. That I was reading this and I said, what a way to get a mess, Americans. Why do you do that? Yeah, because in Spanish it's easier. Estoy enfermo, and that's okay. But in English, that's a little bit different.
Yes. Harder to explain, I guess.
Just definitions, but no, there's nothing that we cannot work. We are doctors. I think that it's the difficult part of this. Now it's
Yeah,
that's the beginning. That's why anatomical parts, body functions as general, like the way we were talking yesterday with our fantastic models. Well, in the way we are talking with them, it's easy for us, but we have to remember the difference between Latin, between technical vocabulary and the normal vocabulary. I mean, for example, oris is in Latin. Carpus is in Latin. Umbilicus is in Latin. Americans like to use this. And I said, why in Latin is a dead language? But that's the way they study. So that's the way even they get more documents. I mean, papers, investigation, they use this kind of description because they consider it's elegant. Okay, we have to use it too. This is one of the most complete charts I could find. That's why I decided to send you to all the class, because it shows you 3 ways of expressions and it's going to help a lot. In the way it's just the introduction of the class. Is a way of getting into the systems and topics we are going to see later and we could work on. Now it's so easy. Then it's going to be difficult for everybody.
Don't say that. I have another question about pronunciation.
Yeah.
This word, cheek or buca? Bucan.
Where?
Cheek.
Check. Where is? Boca is in Latin. It's boca in Latin.
But the pronunciation?
No, boca, like in Spanish.
Buca. Okay.
Yeah, it's like in Spanish. And the check, that's okay?
Yes.
Is that okay?
Yes.
The black
that's
and
okay.
ones are in Latin. Are many ones in Latin. The second one is the social, the common way of expression. And vocal, the one that's in parentheses, is the technical one. Okay, Claudia, we finished our 15 minutes, please. Let me continue. I'm sorry.
Okay, thank you.
No, thank you so much for you. Thanks for being on time. See you tomorrow.
Bye.
Bye, Claudia.
See you.
Agar, good night. I'm sorry.
Don't worry.
You were
Good night.
listening, and that's great. Yes,
Yeah.
please, Agar, do you have any specific doubt?
I have a little problems with the pronunciation.
Yes, tell me.
With the cavities in the thorax and the abdominal cavity and this part. Please.
Could be starting with this, is that okay? Or maybe
Yeah.
not. Okay, super. Let me move this. This one. May I listen to you, please?
Okay. Cranial cavity.
Cranial
Okay.
cavity, excellent.
Superior or superior? Superior.
Superior,
Superior.
superior. Yeah.
Mediastinum. Mediastinum.
Mediastinum,
Pleural cavity.
perfect.
Pericardial cavity witty. Witty or witty?
Within, like
Within.
within, okay.
Within. Diaphragm.
Diaphragm,
Diaphragm.
yep. Diaphragm,
Diaphragm. Abdominal cavity, pelvic cavity, vertebral cavity, cranial cavity. I think that's
yeah, that's okay.
diaphragm. Okay.
Yeah. Give me a minute, please. Sorry, I had to send a note. Any trouble with this? I mean, is that okay there?
Okay. It's
Okay.
It's okay.
Here, well, there's not a clear image. Let me change the presentation.
Okay.
I will show you another one that I've been preparing. Give me a second, please. Sometimes it's too much technology for me.
For
Sometimes,
everybody.
yes.
It's been
For example, that's a good way of getting communication, right?
yeah. It's
Can you see my screen?
Yes, I can see.
Yes, that's one. This one, a purple one. No, no, it's not.
Not that clear.
Yeah, now it's there. Yes. Now can you see the one
Yes,
without
Lisa,
names?
it has no name.
Is that okay?
Yeah, something is.
Is that okay?
Yes.
It's without names, but just for practicing. Is that okay? Is there, and this is another one with names.
That's fair. That
Yes. We are doctors. We like to complicate our lives. We're getting complication. Okay.
Trachea.
Trachea. Yes.
Trachea.
Trachea.
Trachea. Larynx.
Larynx.
Larynx. Okay.
Larynx with an open A.
Okay.
So strange in the pronunciation. Larynx. The trachea.
Yes.
Larynx.
Is confused.
Yes. It's just with practice, and sometimes time is not enough.
See,
Yes.
I have almost 10 years that I haven't practiced English. That it's been hard to remember.
No, it's not easy. I understand you.
Oh, yes. Okay.
Yes.
Aortic arc.
Yes. The arc.
Arc. Oh, okay.
Arc.
Left atrium.
Left atrium. Yeah.
Yeah. What else? Fibrous pericardium. Is that okay?
Let me move it.
Yeah.
Where I lost it. Public heart. Fibrous. This one. Fibrous. Like just in you. Fibrous.
Fibrous.
Yeah.
Fibrous.
Fibrous pericardium.
Fibrous pericardium. Okay. Rib.
Ribs.
Okay? Right. Right. Ventricle.
Ventricle. Where is that? Ventricle.
Ventricle.
See, ventricle without the E, ventricle. Yeah, that's okay.
Okay. Ventricle. Okay. What is? I don't have a problem.
Yeah.
That's,
Going ahead. Well, you know, we like to get in complications.
oh. Really? It's a celiac trunk. Is that
Yeah.
okay?
This is one, the
Cystic.
The cystic, right?
Cystic. Right gastric.
Yeah.
Middle colic.
Middle colic, yeah, the cuts.
Ascending colon.
Yeah, the ascending, that's okay.
Colon, okay. Left colon, no. Left commune, iliac.
Ileocolic, here.
No, and right.
On the other hand, on the other side, yeah.
Another. Left common.
Left gastric, left colic, left common iliac,
Yes.
the left common.
Left common.
See, common.
Common.
Just
Common.
Uh-huh.
Okay. Left common. Left gastroepiploic.
Yeah.
Okay. Yes. It's okay.
That's okay with the rest. Okay.
Yes.
More images. Yeah. The
Uh,
spleen, like E, two E's, like spleen. Yeah. Spleen, like smile, spleen, yeah. Like smiling. That's the correct way of pronunciation when you see two E's. The spleen, yeah. That's so nice.
Okay. Stomach.
The stomach,
Stomach. Okay. Left kidney.
of kidney, yeah.
Left kidney.
The
Small
kidney, like kidney, like kidney,
kidney. Okay.
kidney,
Okay. Small intestine.
intestine.
Intestine. Okay.
Don't worry, that's okay.
Okay. Small intestine. The other gallbladder.
Gallbladder.
Gallbladder. Okay.
Bladder.
Gallbladder.
Gallbladder. Yeah.
Okay. The rest is okay.
Great. Let's go ahead. Now you're getting more confusion. Yeah.
We have yeah.
Yes. I sent you this imagine yesterday in the presentation, but that's okay.
It's getting hard.
This one,
Fifth lumbar vertebra.
yes, vertebra. Vertebra.
Vertebra.
Yeah, vertebra. When we said vertebra, it's just one. We said vertebral, there is a group.
Okay.
A vertebral cord, for example, is not the same than one vertebra.
Yeah. Okay. Yeah. Right common iliac artery.
Yeah.
Yeah. Rectouterine pouch.
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 Rectouterine pouch.
Rectouterine pouch.
Pouch.
Yeah. Proper ovarian ligament.
Yes. The proper
central tendon of perineum.
perineum. Perineum or perineum. It could be said in the same way. Perineum or perineum.
Perineum.
See, could be perineum, perineum with E or perineum with an E. That's it depends on the way or who's talking to you.
What word is more formal, perineum or perineum?
The most common in the Americas and in England, that is perineum. But in many podcasts, movies, I don't know, articles or something, you can watch perineum too. That's why it depends who's talking about it. Depends on the way they pronounce, because it varies from one country to other, from one side to side.
Yeah, okay. And the other one is cavernous muscle.
The muscle, let me check. Ischiocavernous muscle.
Ischiocavernous muscle.
Okay. Muscle with, as if it with an A, muscle.
Muscle.
Yes.
Okay. Ischiocavernous muscle. Okay. Is okay.
That's okay, right? And in the way we get in more confusing time, yeah.
No. Pampin, I know.
Number 10,
Pampini.
let me check something different. This one,
Inferior pubic range.
yeah, Ramos.
Ramos.
It's in Latin, Ramos.
Ramos. Okay.
Yes. And this one,
Pampiniform plexus.
the plexus, yeah.
Plexus. Central tendon of perineum.
Central tendon, yes, that's okay.
Okay. That's all I think.
Yes, that's great. Well, Gar, we finished our 15 minutes.
Oh, very
Yeah. Yeah, but don't worry, we're going to practice it. The next workshop, we can continue. And then in the way I was telling your partners, your classroom mates, we are going to have homework that I'm going to explain tomorrow, please. That it's going to be to the next week. So we are going to have time.
Okay, thank you
Okay.
very much.
Please, to see you tomorrow.
See you tomorrow. Goodbye.
Bye. Hi, Ariana.
Hi, good night.
Hi, how are you?
I'm feeling a little sick.
Okay, great. But Ariana, I'm sorry I can't listen to you very good. It's as if you were so far.
Is it better now?
Just a little bit. Well, let me check if I can help. Okay. From the class of yesterday, do you have any trouble?
No, everything was fine.
Everything's okay?
Yes.
Something you would like to check? I mean, about health and illness, the wellness continuum.
I would like to see again the images.
I'm sorry?
The images. I would like to review them.
The wellness and illness continuum.
No, the images about mediastinum.
Okay, the anatomic body function, the body parts, I mean.
Yes.
Let me stop this and open the other one. Like,
Okay.
is that okay? Can you see this?
Yes.
The presentation from yesterday. Yes. Talking about the ventral cavities, the ventral cavity, blah, 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 the mediastinum. Is that okay?
Yes. But the next image.
The next one, okay. This one?
Yes, that one.
Well, this screen is showing us the division and the limits of the mediastinum, the anterior, middle, and lower, okay?
Okay.
For example, the vertebral column, the thoracic vertebra, and intervening intervertebral discs from the thoracic one. And
Oh, sorry, the intervening intervertebral disc, what are they exactly?
from the T1, the upper disc. This is the first limit of the mediastinum that goes to the sternum.
Oh, okay.
There are the anatomic references for having the division, the correct division. The sternal plane, this line, this cross line, is from the T4 to the sternum, to the body of the sternum, and the joint, the point of union between the sternal and the mango and the body of the sternum.
Okay.
I don't know, the anterior, middle, and posterior mediastinum is just for the division and the organization of the internal organs. I mean, trachea and esophagus are going back even to the aorta. Is that okay?
Okay, yes.
Heart in the middle and the anterior, and then I don't know which one is the doubt specifically about it.
No, I just wanted to make a review.
Okay, that's great. those plans, for example, talking about the mediastinitis, that dismissed situation, we could get it into confusion with this because it seems like a heart attack, but it's just an inflammation of the mediastinum of the posterior specifically. So hard to treat and so confusing in diagnosis. And this division could help us to understand it. This anatomical review, I mean, is going to help us to understand later on the diseases and the illness we are going to study.
Okay.
Now we are just in the beginning, in the introduction of the course with this first session, first class, and then we are going to check symptom signs by systems. In general, in a first meeting, and then more specifically. That's why this course is directed by to doctors. But
Yeah.
that's great. We like to confuse our life to get in a mess. For example, we have a frontal view from the mediastinum, the middle one, and the posterior. Those anatomical spaces and its diseases we are going to study. Any problem with them? I mean, in pronunciation, something that is calling attention, I don't know.
I don't think so.
Okay. About the abdominal cavity, about pronunciation, is everything okay?
Yes, everything is okay.
Okay. The pelvic cavity and pelvis perineum, is that okay?
Yes.
Good, because one test is going to be from these images. I'm preparing that. It's so hard, it's so confusing. Yeah.
Okay.
We are going to have at least 4 tests, one each week, I think. It's going to be great. It's going to be interesting.
I'm going to put the name of the elements.
Yeah.
Oh, okay.
Just completing the imagine, and that's all. With the dorsal cavity, I think there is no trouble. It's the easiest one. The spinal cord, the best.
I don't
About
like
body functions, any problem, any confusing topic?
No, everything, it's okay.
Okay, eating is just an example, but this exercise we are going to work as a homework that I'm going to send you tomorrow, okay? With other functions based on the 5 senses.
With all the senses.
Yeah, is that okay?
Yes, okay.
This chart is the topic, I forgot the word. It's the chanchullo, yeah, it's the chanchullo for making that homework. Now I just forget that specific word, but doesn't matter. This chart is the answer. So I'm going to give you all the material for doing it.
Oh, okay.
You're a doctor, right?
No, I'm in my last semester.
I'm sorry?
I am in my last semester.
Okay, that's great. You're in the final part, so it's going to be easy for you. You are with fresh elements in head. Yes, I finished the university 10 years ago. That's why I'm telling you the difference is interesting. It's when I saw it, I said, yes, I used to do that at, I don't remember when, but I did it.
Yes, anatomy is, I have to review again.
Yes, I think everybody have to check it again, but that's great. It's going to help us a lot. Okay, that's okay. Any doubt, anything you want to ask for, something that you need to check again?
No.
About illness, wellness, is that okay?
Oh, that part, the deterioration index.
this is just an score that I got as an example because it's clear in order to another charts. For example, we have the Glasgow Coma Scale, right?
Right.
This is just for an evaluation at the moment. This is just for a specific time that can help us to get a rapid diagnosis, but just for that moment. That if there is not a very well-trained personnel, very well-trained professional, what could be into mistake, right?
Like in emergencies.
Yes, the Americans even use the Glasgow Coma Scale. That's something more than important. But they have another tools, another ways of evaluation that could be more objective, and it's going giving point to everything. This punctuation is going to show us through the time, independent on the frequency, like a chart, how the patient is going up or going down, how is recovering or how is relapsing.
Oh, okay.
That's easy. Yeah, think again. It's just for checking the patient.
Okay.
For example, the Apache scale. Did you hear about it?
Yes.
The Apache scale is one of the best ones to get the idea when a patient is going to a critical scale, is going to keep, when the patient is going to die. We have that numbers that help us. That's why I decided to use it, because when we talk about the illness wellness, this one specifically, they even have numbers for giving us a category. With this category, is easier to get our job done. It's something that in Latin America we usually don't do. We use another kind of criteria, another kind of school, I mean, and then we use another kind of evaluation. But this is better. I tell you by my experience. I use it when I was with my patients.
Yes.
And it helps a lot.
It helps with the probabilities.
Yes. It goes specifically to statics. And you have a scientific way of communicating or getting information, even to the family. Relatives, I don't know, the one who's in charge of the patient. And you have a I don't know how to explain this. You have an objective point of view that the patient cannot discuss with you.
Right.
Yes, this is goodness, illness and wellness. It's the idea that English speakers use to for understanding. Well, is that okay?
Yes, everything is okay.
Okay. Any doubt about this? About the concept of relapse, remission, recovery, improving, deteriorating?
No, that was clear.
Yeah. Sickness, the same of illness. Is that okay?
Kind of.
Kind. It's with practice we are going to find the differences and then got all the topics clearly. It's just with practice. They like to get confused with this. We get in Latin America with another things confusing. That's just a difference in concepts. That's all. The way of asking, that's an important topic, because sometimes while being doctors, we don't consider that we didn't use the correct word, the correct way of expression. And if we didn't do this, we didn't ask specifically, the patient is not going to tell us specifically the answer.
Yeah, they don't tell us if we don't ask.
Yes. And sometimes we ask in a technical way, what are your symptoms? What are symptoms, doctor? I don't know. I didn't get scholarship. So, okay, how can I ask something that you could understand? That's why. What is going on with your body? It's easier to understand. What do you feel? How do you feel? That's better. That's a more popular way to ask. That's a more common way. What hurts? It's harder for someone not to say if it hurts or not. It's clearer. Is that okay?
Yes, it's okay.
Yeah. Though this list of questions is just for showing that there are many ways of asking, just on creativity, and the way of being clear is going to be appearing through the time. Yeah.
Yeah, okay.
Anything that you would like to ask about?
No, everything's clear.
Perfect. So see you tomorrow night.
Okay.
Yeah.
Have a good night.
Have a good
Bye.
night. Thanks for being on time. Bye. Hi, John Harold.
Hello, teacher.
Hi, where are you from? I see you're from Bolivia. We are in the same country.
Yeah, we are. I'm from Santa Cruz. Yeah.
Yes, that's great. That's so hot, I mean.
Yeah, very hot.
Yeah, that's great. I miss to live in that kind of weather. La Paz is so cold. Now, especially at
Oh.
night, it's extremely cold.
So you are from La Paz?
Yeah, I'm in La Paz.
Right now you are in La Paz.
I'm sorry? Can you repeat, please?
Oh, okay. So right now you are in La Paz?
Yes.
Okay. No,
Okay.
I'm only asking for that.
Yes. No, that's okay. When I saw yesterday, I said, he is in Santa Cruz. Yes, I know it. I don't know how, but I had that answer. Please tell me, John Harold, what is any question that you have about the presentation from yesterday? Vocabulary, pronunciation, something that you like? Tell me.
A little bit of doubts about the remission, relapse, and also about the illness, sickness. That part wasn't very clear for me.
Okay, can you see the presentation? The
Yeah,
it's opened. Yeah. Let me get it bigger. Yeah, now it's better.
Yeah, it's better.
Okay, into the American way of talking, I mean, or English speakers, even if I'm from USA, England, or that places, they like to get in that confusing way of talking. In Spanish, it's easy. Is I am enfermo, estoy enfermo, and that's all.
Yeah,
yes,
that's
me
easy.
siento mal, and that's okay, right? But in English, they like to get these 3 specific words that can describe the way that they give the importance of the situation. I mean, sickness is just the symptoms, telling in a simple word, the symptoms that the patient feel, and he says, I'm sick, estoy enfermo, me siento mal, I'm sick, and that's all. What do you have? I have a seasick, I feel nausea, I was vomiting, I'm sick. That's why they like to get in common nausea and vomiting like sickness. They use symptoms as a sickness. Is that okay?
Yeah.
It's easy to understand. For example, seasick son mareos, right? We know it. But mareos, the dizziness is a symptom. We cannot watch it. They use symptoms for sickness for the way they feel. Yeah.
Okay. Yeah, it's like they're describing the way they feel.
Yes.
Like in a consultation, right? Yeah.
Yes. So when a patient get into your consult and they tell you, I feel sick. Okay, what's wrong? How is your sickness? And they started the symptoms of the situation. Is that okay?
Okay. Yeah.
When we talk about disease, it's a situation that could be called chronic in a way of understanding it. Something that is wrong in your body function, something that is really bad, and a physiological and psychological dysfunction. For example, when you got a cancer, you have a disease or you have an illness. You have a disease.
Yeah, this is, yeah.
A disease, because the cancer is going, this not just taking the physical part of the situation, it's just the psychological, the way that the patient is attending this. Maybe the patient is not in the appearance of being with that situation, like a first sight to watch it and said, oh, he has a chronic disease, he has an epoch, right?
Yeah.
The disease is the situation that is something wrong, something that is not killing you at that moment specifically, but is something that through the time would be harder to solve. I mean, is that okay?
Yeah, I understand. Yeah.
And the illness is that the person of that specific disease that affect, that affect the perception and behavior of the person, of the patient. It has an impact in psychological and physical environment. I mean, for example, coronavirus. It's an illness, and when you give the diagnosis, the patients get crazy, get mad, and says, why me, not me, I couldn't get this, right? In our country, it's very common to talk about it in that way, about tuberculosis, for example. When they receive this, the diagnosis of tuberculosis, they think that it's a cancer. They said, why I have this? Doctor, please cure me. I'm not going to die, right? Is that okay?
Okay.
Illness
So for example, if they say like I have diabetes,
yeah,
so that will be a disease.
a disease. It's
Yeah.
a situation that you can control, that you're not going to cure, that you have to re-educate your patient in order to live with that situation.
So can you give me another example of an illness?
Yeah, for example, I don't know, gastroenteritis.
Okay. Yeah.
That's an acute illness from the digestive system, right? You get the treatment,
Yeah.
you feel bad, you think you're going to die because it's a terrible situation. Your psychological and your physical situation are affected. And the subjective state of the person is that it's not going it's not going to recover. Is that okay?
Okay.
Illness is an acute situation, then the patient think that it's not going to resolve, it's not going to recover from that specific illness, from that specific infection, I mean.
So when we're talking about illness, so I will think like it will be something like they have so they have symptoms that they feel bad at the moment, right?
Yeah, at the moment.
Okay.
With a disease, could be with the cancer, I mean, without symptoms, it could be controlled. A diabetes could be controlled without symptoms, but it's a disease that the patient has for a chronic time. It's not going to be recovered.
Yeah.
Is that okay?
Yeah, that's clear right now. Yeah.
Excellent. Any other doubt, I mean?
Yeah, about the relapse, recovery.
Yeah.
That
this
part.
One, right?
Yeah, that part.
Yes, talking about recovery is when the patient returns to normal health after illness, he had recovered. That's why I was telling you. Illness, that acute situation when the patient thinks that it's going to die, for example. Is that okay?
Yeah.
We use the treatment.
Recovery.
Yes, we use the treatment, antibiotics, I mean, anything we need. And the patient gets again normal, gets recovered from an illness that was getting life into risk.
Okay.
Is that okay? We use treatment for a few days and we cure the situation, we solve the situation. Yeah?
Okay. Yeah.
Okay.
And also the part of relapse?
Yeah, let's go first there. For example, we have a patient into the hospital with tuberculosis, that it's easy to understand this. We start treatment, taking the 4 drugs that we know.
Yeah.
The first way of curing this infection, and the patient gets better, tolerates the tablets, tolerates the new diet, but through the time with this treatment, the patients again get worse. He was going good, tolerating the treatment, tolerating the tablets, but there is a point when the body doesn't respond in the way we expect, and the patient again gets worse. He has relapsed. That the good he was going down again. He's deteriorating again. Is that okay?
Yeah, that's fine.
For example, with the cancer, it could be happen too. He's going to with the treatment, tolerating the chemo, and then suddenly gets an infection, and the infection destroys our good advance. The patients relapse again with the cancer and with more aggressive way. Is that okay?
Yeah, that's fine. Thank you.
Then we have improving the process of recovering. Is that okay?
Yeah.
Yeah, deteriorating.
Yeah, I understand that part.
Understand this. Perfect. Remission.
Yeah, that one. If you can explain a little bit about that one. Yeah.
Yes. When you are into, again, a chronic disease, for example, like cancer, in the way the example I was writing down, we have some cancers like, I don't know, leukemias. When we were child, we were treatment, and we are in a good health. We are getting healthy in our teenagers, right? When we are teens.
Yeah.
We destroy our advance, taking bad habits, and being an adult. No, I'm sorry, I'm getting confused. We take the treatment with the leukemia when child, teens, we continue with our treatment, with our controls, and while being adults, we get in control, and there is no sign of cancer, of leukemia. There's a remission. That's a cure, because we know that leukemia doesn't get cured. It gets stopped, no more advance, it gets controlled, and it gets asleep, right?
Yeah.
The remission is that way when we said that there's no manifestation of the illness, of the disease. I mean, no illness, the disease.
So it's only applicable to some types of illness, right?
With chronic situations, it's the most applicable way of this word, of this definition.
Okay, so when we say remission, we cannot use it for typical illness. Like, for example, if we say diabetes, it will be relapse, then recovery, right?
No, diabetes is not going to be cured. Without treatment, the patients turn into deteriorating.
Oh, okay, so recovery is when we cure. Okay.
Yes, remission just for diseases that are chronic, that we know that are not going to be cured.
Cure.
But
okay.
at the moment of starting, there is no sign of getting worse. That are controlled,
Okay.
I mean, without treatment.
So it's only for diseases that they don't have cure for that, right?
Yeah.
Okay.
For example, I don't know at this moment. For example, let me think of one. Just forget the name. I was thinking on an example about it. Tell me a chronic disease.
So can we use it for like Parkinson or Alzheimer?
Well, they could be controlled. They could be improving, but they even don't have a remission because they tend to advance and get more spheres of life, even with the actual treatment by neurosurgery, I mean.
Okay, so yeah,
By remission, for example, the rheumatoid arthritis.
yeah,
There are
rheumatoid
patients that with treatment for years at the beginning get it
yeah, it
controlled.
gets stopped. Yeah.
Yes, they can stop, they get control, but it is not going to be solved. It gets in remission.
Oh, okay, yeah, I understand. Yeah.
Okay, that's good. That's great. Any other doubt? Because we have, it's over 15 minutes are left.
Yeah. So I have a doubt, but it's not about the material. It's a little bit. You said something yesterday about that we're gonna have quizzes, or I think like homework.
Yes, we are going to work on it, but I'm still preparing in the way we are talking, because I'd like to know the level you are, and this first session is helping me.
Okay. So you're gonna give it to us, like, for example, tomorrow, right?
Yes, tomorrow night exactly. I'm going to give you the first homework for the next week. You're going to have a few days to complete the name, and then we are going to work on it. At least we have to get 4 or 5 assignments between quizzes. I don't know. Well, I'm preparing it. It depends on the level of the whole group. Imagine you are advanced and other people is not so much. We have a first year student. It's not just to take care the same test as you, that you're a doctor.
Yeah.
That's a huge difference. That's why I have to combine and then complete.
Yeah, it's hard work.
Yes, that's an interesting work. Okay.
No, that's my only doubt. Yeah, thank you.
Don't worry. So tomorrow I'm going to explain you about the application I need you to install in your cell phones, the Kahoot.
Oh, okay, yeah. I already use it for something.
That's great. So let's see you tomorrow. Let me continue. Yeah.
Yeah. See you tomorrow.
Okay. See you tomorrow. Bye.
Bye.
Hi, Catherine. Hi,
hello,
Catherine.
teacher.
Hi, how are you,
Hello.
Catherine?
I'm fine.
Do you have any specific doubts, something you would like to?
Illness.
Yes, that's the most confusing part, right?
Estoy un poco de resfrío, tos, cough.
Don't worry. If there is difficult to pronounce, I understand you perfectly.
Okay.
Let me check my list. Ariana, Johar, Catherine, yes. Yes, Catherine, it's your time. Yeah. Tell me, the illness and disease is your principal doubt?
What is the difference between illness, disease, and sickness?
Yeah. Let me share the screen, please. Give me a moment. It's been too much technology to me. But now, yes. Can you see the screen?
Okay.
Yes. Can you see? Yes. Is that okay? Can you see? Can you see it, please?
Yeah. Yes, teacher. What's difference?
Well, let's talk about it.
Situation?
Well, the sickness, disease, and illness is the way that our gringos, our American patients, I don't know, English speaker patients get to confuse us. It's the way they decide to call the way of they feel, forgetting a difference. In Spanish, it's easy. Is estoy enfermo, me siento mal, and that's all. but in English they like to say
The moment.
yes, it's
I-
at the moment it's clearly, but I think they are in the same confusion that us. But going through, sickness is the way that the patient feels. I mean, how the patient gets, how the patient thinks is. It's about symptoms specifically. Is that okay?
Oh, yeah.
They say, I feel sick.
Yeah.
They principally refer to nausea and vomiting. How do I feel? I feel sick and bad. That's why I feel nausea and vomiting. That's the best. Or for example, are you okay? No, I'm with seasick or dizziness. Is that okay? Seasick,
Okay.
los mareos.
It's
But there are symptoms.
symptoms. Okay.
Symptoms. Talking about symptoms, is how they feel, how they react about the way they are feeling. Is that okay?
Okay.
The disease.
This.
Yeah, tell me, please.
Yeah.
The disease is something that is wrong in your body function, something that is in a physiological and psychological dysfunction that is affecting your life, but in a chronic way, we could say. For example, a cancer. Is that okay? It's something when, for example, you have a patient in your first sight and you could watch him that is normal, but while talking, this patient has diabetes, for example. It's a situation that has no cure, has no relapse, has no remission.
Oh, no remission.
No remission.
Example, arthritis.
Yeah, the arthritis has no remission. We can control it, but we can't cure that situation. Is that okay?
Okay.
The illness is that acute situation, we could say, for understanding, for the term to understanding. When the perception of the patient changes their behavior too, and changes the response of the disease, of the situation. The impact is psychological too, it's physical too. It involves the subjective state and the physical state. I mean, for example, the coronavirus. Is that okay?
No symptoms? Oh,
No.
Yeah.
The patients feel the symptoms and looks bad. The patient has a body dysfunction and has a psychological dysfunction because the signs are too high. And when you give the diagnosis, they get mad and they say, why me? How could I get this? And that psychological changes, of course, get force the patient.
The
mental status.
Mental situation.
Yes. The mental control get destroyed. Get destroyed with this. So the mental control helps that body responds to many illness, many diseases, right? The stress too. If we are in an illness, is for example, something that we can solve. Then illness we can solve. For example, a gastroenteritis we can solve.
Oh yeah, yeah.
Is that okay?
It's okay too.
Okay. About recovery, improving, deteriorating, relapse. Is that okay?
Understand.
Yeah, they're just definitions, but those definitions are going to help us to explain.
Yeah. How the pronunciation thoracic cavity?
The thorax. Like
yeah.
Thorax.
Yeah.
The thorax, like the third one, the thorax, yeah. But the classic TH, right?
Yeah. Complication.
Okay. The thoracic cavity.
thoracic, yeah,
The thoracic, yeah.
thoracic.
The thoracic cavity.
Okay,
Yeah.
okay, yeah,
About pronunciation in this imagine, is that okay?
okay.
Or anyone that
Uh,
is getting difficult?
One brachiocephalic trunk,
And the trunk.
okay.
Yeah. Which one else? This one. That's easy.
Okay.
How do you pronounce this?
Fissures, oblique fissure of the lung.
The scissors.
Yeah, fissures.
Just the scissors. Yeah, return fissure. No, where are the scissors? I lost it. The fissure and the scissor. There are differences. This is fissure.
Yeah.
And the scissor, it's another that I can find here, maybe in another image. No, I don't know what I did. It's too much technology, I mean. Yeah. Well, that's okay. Any other? Well, never, let me check from this here. Well, the anatomical review that we always make here. That's okay. Something new.
And that's okay, teacher. So, yeah.
About the abdominal cavity. How do you pronounce this?
Spleen?
No, spleen. Like a smile. Spleen. Yeah, with E.
The spleen.
The spleen. Like smiling is the best way for telling it in the correct way. And the one that is upside. This one.
Oh yeah. Spleen.
No, splenic.
Splenic. Spleen is splenic.
Yes, the spleen. The spleen.
Spleen is
with the spleen, yeah. And the splenic and the spleen.
Yeah, confused.
Another one. That's so interesting. This one, gastro.
Gastro.
Don't worry, gastroepiploic.
Epiploic.
Yeah.
Oh yeah. Right gastroepiploic.
Yeah. The right one. The right gastroepiploic.
El otro, spleen y
splenic.
Splenic. Okay.
Spleen is splenic. That's the best.
Okay.
Here, this one, I hope you can read it. It's not too clear. This one.
Gallbladder.
And the gallbladder, it's also an I, but it's an L.
Oh, no.
Yes, the gallbladder.
I know. Gallbladder.
Yeah, the gallbladder.
Yeah.
For example, when we're talking about synonyms for a small and large intestine, we can call them bowel too. The small bowel, the large bowel. That's a grammar point, that a grammar key that can help us. That's a way of expression, something new. Okay.
Okay, teacher.
Let me show you another explanation. We have 1 minute.
Yeah.
This one is. Is that okay? Can you see this? The purple one? Yes. Okay, health and illness, that's a recovery. That's a refreshing time. That's the way we can ask. Well, how the patient says,
Okay.
I'm having trouble with, or hip, shoulder on a specific part of the body, or maybe something bigger. And the correct way of asking, do you get any pain in? Just something specifically. Is that okay?
Okay.
I'm
Okay.
going to send it tomorrow to the class, so don't worry. And
See
describing
you
the.
tomorrow, teacher.
I'm sorry?
¿Eso avanzará mañana, teacher?
Yeah.
En la teoría.
No, tomorrow we have another plan of class. But this second presentation, the purple one, I'm going to send you as helping you for starting, because I understood that you didn't receive any guide for taking this course, right?
Okay.
In the way I thought I get a solution with the superiors of the institution, I'm been sending you the information I get and the classes I'm preparing. That's okay. I think that's the best way for starting. Yeah, we have to share knowledge. From body parts, don't forget we have the Latin, the English one, the common one, and the technical one. For example, oris is in Latin.
Oris.
All the blacked ones are maybe in Latin, it depending on the part, or in the technical way of talking. Is that okay? That's why you have to study. That is the most complete imagine I could find.
Okay.
Well, we talked about it. Yeah, that's all I think. Tomorrow. Well, that's time. I'm sorry, Catherine.
No.
But,
No
I'm
problem.
going to be more time, but we are going to find a solution, okay?
Okay, teacher.
Okay, see you tomorrow.
Thanks. See you tomorrow, teacher.
Okay,
Thanks.
try to check. Bye-bye.
Bye. Bye-bye.
Bye. Hi, Mario.
Hi, teacher. How are you?
Hi, everything's okay. How are you, Mario? How do you feel?
Oh, everything's fine.
I see you are from Guatemala.
Yeah, from Guatemala.
Yeah, nice place. Really. I
Yeah,
have good friends
really,
from
really
your country.
Ah, yeah, it's a pretty cool place.
Yes, I remember my friend with too much love. Yes. Okay, about the presentation from yesterday, do you have any specific doubt? Something that you want to study again? You want to check? Any questions?
No, I haven't. I just had a question about the Latin names and like this, the basic names.
Yeah.
It's like in Spanish that we use with our medical colleagues, the Latin name, or we can use the English terms.
Yeah. When we talk with the Americans, yeah, for saying in a way, they like to get Latin for using, I can tell you, a formal way of expression.
A formal way.
But extremely formal way. I mean, for a seminary, a huge course, a worldwide conference in Latin, because it gives them more importance, they said. For me, it's more ways of confusing.
Yeah.
That's the way they choose. So we have to respect. This chart, the one of the men, our male model. Yeah. And that's the most complete I found in net by the internet. And in this one, we have the Latin name, the cranium, the oris, the carpus, the umbilicus. You see, that's in Latin. Because in a way, it's a dead language. It doesn't matter for Americans. They say that it's a great way because it's our way of beginning in medicine world. Is that okay?
Okay. Yeah.
So that's the same. If you say the name in Latin or in the technical way with colleagues. Okay.
Okay.
Just with colleagues is that the way they reserve this kind of vocabulary. Is that okay? For example, we have the boca. Boca is the check. In English is the check. For us, el cachete, la mejilla is different. When we talk in Spanish, we say región malar, right?
Yeah, it's kind of different.
Yes, that's just for checking that in Latin way, the Latin expression is for a very, very formal way of talking. I use this imagine, well, I decided to put into this first class because it's like an introduction of the whole, all of the course. While we are going through the next topics, next systems, organs, some things that are going to be specific, we are going to Latin a lot. We are going to use that kind of expressions. Is that okay?
Okay. Yeah, it's okay.
From this image, you have any doubt? Something that is confusing maybe?
I have.
That's okay.
No, I don't have.
Yes, about the anatomical body functions, is that okay? The body parts, I mean, ventral cavity, dorsal cavity, is that okay?
Yeah, I think it's okay. I don't have any doubts or questions.
Any pronunciation, is that okay? Everything?
Yeah, it is. Yeah, it's okay.
That's good. Here, well, for example, let's go to the grammar keys. Yeah, some details that could help. For example, talking about health and illness, that's a graph that could help in a little way. For example, if you are in a good health, you are well and have no illness, no disease. If you are healthy, you are normally well and can resist illness. Can you check the difference?
Yeah.
If you are fit, you are well and strong, and you can, of course, resist illness better than the rest. Is that okay?
Okay. Yeah, it's okay.
Okay. Those circle ones just show us the way that ill could be called unhealthy, unfit, unwell, not very well, poorly. Well, that's just a grammar key for helping to understand the way that patients could explain to us the way they are.
Yeah.
The next one, and that's homework, but it's for tomorrow.
No
For
worries.
example, when we talk about limbs, of course we say limb just an arm or leg. But we as the doctors understand that upper limb is the arm, lower limb is the leg. That's all. That's the way that the patients can abbreviate it. My limb hurts and show you your arm. And they said, okay, it's hurting the upper limb. Okay. And the way that usually patients say or express is, I'm having trouble with my, and the specific part of the body, or maybe a region of the body. Is that okay?
Okay. Yeah, it's okay.
For example, do you get any pain in, or do you get any pain in your, just this is a way for asking in a correct way to get specific information. Is that okay?
Yeah, it's okay.
Good. Moreover, the radiation of pain, the patients, when telling us how they feel, they said it starts in the back, or they said it hurts here and shows you the back, it hurts here and moves there. Usually it happens with patients, but you have to describe with the correct verbs. For example, starts in, go into, down to, or down there. It depends on the situation, right?
Okay.
And as a doctors, we have to order that speech of the patient and get a good conclusion. Is that okay?
Yeah.
And moreover, we have the synonyms For example, a small intestine could be called a small bowel. Is that okay? Bowel, the
Yeah.
same as intestine. Large intestine, large bowel. Or many doctors, many colleagues also refer to the anus and rectum as the back passage. Of course, it's in the back, it's a passage. There are ways of they are talking. Just as an example, I'm telling you this because when we get into the specific situations, the specific organs or systems, we are going to talk about it in more detail. Is that okay?
Okay.
Well, body parts, we talked about it. There's no confusion with these concepts, right? Recovered, improving, deteriorating, relapse, and remission.
No.
That's okay.
Yeah,
Right.
that's okay.
Super. Yeah. Talking about body functions, is that okay?
Yeah,
using the verbs, I mean.
Yeah, hungry, saliva, appetite. Yeah.
You chew it and swallow it. That's okay, right?
Taste. Yeah, yeah, everything is okay.
This chart is clear. Everything, I mean.
Yeah, yeah, I got that chart.
Perfect. About pronunciation too, right?
Yeah.
Great. How to ask about. This is a way, another specific way to ask about another topic, another key, just for example, okay?
Okay.
As we said at the beginning, do you have any trouble? We can change for, do you have any difficulty? Do you have problems with? Is that okay?
Yeah.
And this is they are combining with the body functions. Is that okay? Walking, breathing, passing urine, with your speech, with your, for example, going there, with your step, with your gait, with your breath, with your urine. I mean, it's easy to understand this. And it's a correct way of asking, or do you have any pain when you breathe in, when I touch here, when I move this, when I move your joint? Is that okay?
Okay.
About the five senses, this is the, I forget the word, the chanchullo for our homework. Don't miss this. Okay. By sight, by using eyes. With this chart, we're going to work a similar chart like this and like this as a homework, but I'm going to explain it tomorrow. Yeah.
Perfect.
Okay. And well, that's all. We have 3 minutes left.
Okay.
Okay. Any doubt?
No, I don't have any doubt.
Okay. About pronunciation, everything's okay, no?
Yeah.
Perfect. Yeah, I'm sorry, I have to send a note.
Don't worry.
Okay, let me stop this. I'm sorry, I have a baby and my baby's starving.
Don't worry.
They're asking me how to prepare her milk. But that's
Don't
okay.
worry.
Okay, that's all, Mario. Everything you need, please let me know. And then we can call it maybe by WhatsApp or, but that's the best way. WhatsApp is the faster one. I mean, I like it. Mario, okay. Mario, are you there? Hi.
Yeah, I had a connection dysfunction.
No, don't worry. Connection is not always in the way we expect.
Yeah.
Okay, don't worry. So I'll see you tomorrow. Is that okay? We have almost a minute finishing.
Okay. See you tomorrow.
See you tomorrow. Nice to meet you, Mario. Shalene.
Bye.
No, you can stay. Um, well, let's wait. Well, now it's the turn of Michelin, number 11. And well, I'm waiting for 3 minutes, I mean. If there. Well, she doesn't get. Maybe Joyce Quevedo. Joyce Quevedo. There are no news about about Michelin Diana. Mercedes Joyce Quevedo. Please, you can get. There is no answer from here. Michelin. Well, there's no answer. What shall I do? What? Nom, nom, nom. I'm going to check this. No. Nom, 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 nom. Babies are crying. That's not a good. No, the babies are crying. Fine. Well, Michelin doesn't get into. I'm calling the next one. Joyce Quevedo, that's the 12th, the last one in my list. So I'm going to call her. Mercedes Joyce Quevedo. Joyce Quevedo. Nobody's coming. Oh, Joyce. Yes, Joyce. Workshop. Hi, Joyce. How are you? Hi, Joyce. Can you listen to me?
Hello, sorry. Can you hear me?
Yes, clearly. But if you could get a little bit of volume, it would be better, please. Wow, you're on the street.
Yeah, sorry. I was asking what time was my turn.
Yeah, no, don't worry. Don't worry. It's not difficult for you to be in the street. Not dangerous, I mean.
I'm ready. No, I'm not driving. Somebody else is driving.
Okay, that's correct. Give me a second, please. That's okay.
Okay.
That was send me a message. One student that didn't get into the class yesterday. And I said, what? What happened? So in order he doesn't have a place of this workshop, well, I was telling him the moment for getting inside. Okay, Joyce, yesterday we were talking and you told me you're a teacher, an English teacher.
Yeah, kind of, not actually a school teacher, but a university professor. Currently not working because I tried to take this year like for myself, but I was still with some small contracts at university.
Yeah, that's great. How did you get this class? How did you get to say I'm going to do that? How did you take that decision? I mean,
actually, I was trying to. Well, I don't really like to stay in the same place for long. So I work at the languages department at the languages school at university. But I was trying to look for a different job. And I know that some places are going to be available next year for medicine and for the health area. And besides that, I have had a lot of experience from the health area as well. So I wanted to practice a little bit of English from the area.
Perfect. So that's the best way. You're going to be with a good base into the healthy mode world. Because in the way I was telling your classmates, the best information comes in English.
Yes, actually, yes.
Yes, and the actual one, I mean, the best seminars, the best worldwide sessions are in English, all of them. Even if we're in Spanish and we're in a live stream or watching that, it's in traduction to English. So we have to know this language. That's great. Well, from the presentation that I sent you yesterday that we made, do you have any doubt, any question? Because there are many concepts that through the career doctors we are studying, maybe all the time in a very, I don't know, very unexplained way, because we get into that concepts by practicing. But in order you are, even for starting in this healthy world next year, it's going to help you a lot to get a huge step. You're going to win a lot.
Yeah, actually, yeah, vocabulary, especially.
Yes, the vocabulary is going to help a lot, so much. When I was at the university, my anatomical books were in Latin. So I said, what? It is a language that is dead. Why do you give me this? Yeah. And they said, because it's important for you. You are going to understand that when it's the moment. Now just study. And I said, okay, ni modo. Yeah. And they had the reason. Finally, I understand why they did it.
Oh, well, yeah. You don't get to see those things until you need it.
Yeah. You are concentrating knowledge and integrating that knowledge in order to get a huge concept. And that's the best. Yeah. Do you have anything you want to ask for about from yesterday?
About yesterday, not really. I think it was some of the basics and some definitions that I already knew in terms of language, as you were mentioned about illness and sickness.
Yes.
But then no, I was just giving a quick eye to the vocabulary because I think it's more, that would be the complex part of the learning, the pronunciation of the words.
Yeah.
Or the listening part of the words more than the pronunciation itself.
Yeah.
But about any other thing? No, not really.
Not really. Okay, well, great. So let me share the screen from yesterday, from the one that I prepared for today. Can you see a purple presentation and my purple one?
Yes, I can see.
Perfect. Let me get it bigger. We have ways that patients or that people can tell us some ways of some kinds of expressions. I mean, of course, you know it maybe better than me. And maybe many ways. For example, when you are in a good health, you are well and have no illness. You have no disease, nothing that is affecting you, right? If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. There's less possibility to get into illness. Is that okay?
Yes.
Can you check the difference in good health, healthy, and fit?
You want me to give you like a good definition? Like good,
not the definition, just an example in the way for talking. Because
I think like fit would be more like physically.
Yes, physically, how they physically feel. That's why I mean, for example, healthy, fit and well, very well. There are ways that patients express. Even unhealthy, unfit, unwell, poorly. That's why that patients come to talk to us. They tell us, I feel in a poor health, I'm bad, I'm unfit. So that's why a way of expression while talking, while having a speech with a patient. That's why in order you to start it next year, it's going to help you to understand what they mean using this kind of words. Because, well, you know, in English, it's a very direct language, not give so much explanations, not too confusing, go to the point, and that's the best. But in the Spanish, we love to talk sometimes more than we really need. And that difference while treating patients, treating even our colleagues, is important. The difference between recovered, improving, deteriorating, relapse, remission, I think it's clear. Is that okay?
Yeah. Yes, clear.
That's great. That's great. For example, we have patients that just talk about limb. They said, my limb hurts, and show you the arm, but we know that it's the upper limb, for example. I have so much pain in my back, and to my back goes to my limb. Limb, it refers to the leg, I mean. That's the way that patients talk to us. That's why I was getting in. Is that okay?
Yes, everything's okay.
Moreover, they said commonly, I'm having trouble with my, and then said the part of the body could be in the common way, in the social way, or maybe in the technical way. Or even if we are with colleagues, for trying to get in a good image, they could use Latin. So we have to know the 3 ways. But in order we are getting into this world, the situation that you are teacher, you are going to study into the health sciences in future, is the way that, well, I was asking for this specifically because of the way of evaluations that I'm going to ask you. It's not the same to tell you a medical evaluation that a not medical one, right? So we have to be in justice. We have to make the things in the way we can do it. And the objective of the course, of course, is just vocabulary and ways of expression. Okay. For example, doctors love to ask, do you get any pain in your, something specifically or something in general? But moreover, when we talk about specific kinds of questions, we have to understand that we as a doctors have to order the speech of the patient with specific verbs. Starts in, go into, goes into, down to, down there. And while going through the course, we are going to use it more. It's just an introduction. Moreover, we have synonyms. For example, the small intestine is the small bowel too. Large intestine is the large bowel too. Bowel is the same as intestine. And we are checking this in the next sessions. So in the moment you have troubles with this, tell me, because it's going to be a technician way of asking for, of expressing in a medical way. But I wouldn't like to get in confusion because of this. I'm sorry. From here, do you have any question?
No, not at all.
Okay. For example, a common way to refer to the anus and rectum, even between colleagues, is the back passage. Of course, it's in the back, it's a passage, goes through the feces, and that's all. It's a way of expression that we are going to be practicing later on, okay? About body parts, any doubt do you have?
No, nothing, just to practice some of those words.
It's just for reading, for studying. Most of them in the Blacken words are in Latin. For example, bucca, cephalon, cranium. Those ones Latin words, then are continuing with the technical, the school, the cranial. I mean technical. The school is the most common way in the social media to find the word. For example, the carpus is the Latin, wrist, the social media, and the carpal in the medical technical world. Is that okay? So it's just to find the differences And then, well, Latin sounds in many words, I mean, like Spanish, and that's okay. This is boca, no buca, that's boca, or check, when technical vocal. Is that okay?
Yeah, you mean the cheek, right?
Yeah, the cheek. Yeah, the cheek,
Okay,
the cheek, that's okay. So this is the most complete image I could find on the internet in the general view, and I liked it. That's why I sent it to you. It's going to help us a lot. About the internal parts of the body, the dorsal body and the ventral body cavities, everything's okay, right? Great. So let me discontinue from this. There are lots of images. I've used it with your classmates. Yeah. About body functions, any doubt you have about the it's a process, of course. Well, I try to describe. And in this chart, I show more functions or verbs and the noun of the function, of course. Do you have any doubt about this?
I think you're not sharing your screen anymore.
Oh, I'm sorry. Sharing. Okay, let me do it again. My lap is getting crazy, so I have to make it check. Is that okay? Can you see it?
Yes, no, yeah.
Yes, let me get it bigger. Yes. Okay, with this chart, do you have any question? It's just a brief chart. Speaking, walking, breathing, urination, micturition, defecation, menstruation. Is that okay?
Yes, everything's clear.
Yes, here we have the synonyms that usually use in the social media. For example, it's not common to an American says feces. They prefer to use stools. I need stools, a little bit of stools for sending to the lab tests. They said, oh, stools, okay. If you said feces, they feel offended. And you said, why did I say wrong? Why he's offended? And that's because of the word. They get into bad interpretation. I told you by experience, that was so embarrassing. So, even, well, yeah, okay, going to the ways of asking. We as a doctors can use this way. Do you have any trouble, difficulty, problems? Do you have any pain when you breathe in, when I move it, when I push here, when your joint does? Is that okay?
Yes.
That's a little key for asking in a correct way. Is that okay? Or maybe giving orders, take a deep breath in, hold your breath, then breathe out completely. Is that okay? I think it's just saying the process of doing something, right? About the five senses, well, this chart is going to be the I don't know how to say it. I just forgot the word and I don't remember the chanchullo. How do you say that? I'm sorry.
I don't know. I've never used that word though.
I'm going to look for this. I was thinking on all the day, and when I started with the workshop, I forgot the words, and I said I'm going to find it, but I'm going to tell you tomorrow. Yeah? But this chart is the one that we are going to use for homework, and tomorrow I'm going to send you everybody. Okay. In the way you are not a doctor now, you are going to study from next year. I'm going to organize your homework in a different point of view in order for not to give you a complicated thing that it's out of your objective. Is that okay? Or do you prefer the same homework as the rest?
I don't mind. Actually, it's just anything that help me practice is okay.
Okay, for practicing would be okay for giving orders or maybe ordering like this because it's a chart similar that we are going to make. Okay, and the practice makes progress. Yes, I liked it a lot. We need to practice. Practice and practice is going to help you know it better than me.
Yeah.
Yeah.
Actually, yes,
Any,
we need
any
a lot of practice.
question about the course? I mean, something you would like to punctualize now?
No, nothing, I think. I think everything is clear.
Okay. If you have any doubt or something like that, please, I'm in order. I'm here, there's no problem. I have a chart when I can see where is each student from. You are from Bolivia, right?
Yes.
Yes, me too. Where are you now at this moment? In which city, I mean?
I'm living in Sucre now.
In Sucre. Wow, the white city.
Yeah, I'm originally from Oruro, but I've moved here like 10 years ago.
Oh,
More
that's
like
okay.
15 years ago.
No, that's great. Well, now I'm in La Paz, so there is no problem. We're in the same country. That's relaxing.
Yeah.
Yeah. Yes, because we have classmates from El Salvador, Ecuador, Nicaragua, from many parts of Latin America, Central America. So they are nice. We are going to have fun with them. Yeah.
That's right.
Well, I think that's okay. We have no trouble, right?
Yeah. We have class tomorrow at the same time, right? Like from 8 to 9?
I'm sorry, I didn't understand you so clear. Can you repeat, please?
We have class tomorrow at 8.
Yes, at 8.
Okay.
Yes, at 8. Just the workshop is going to start 7:30. Or maybe I have to talk again with the coordinators to get into a better schedule time for everybody.
Okay.
Okay, and maybe working in pairs could be better in the next workshop. I'm going to get into negotiation with that. But tomorrow we'll see at 8 p.m. Is that okay?
Yeah. Everything's okay.
Okay.
See you tomorrow then.
Okay, see you tomorrow. Have a good night and take care.
You too.
Take care.
You too.
Bye.
Bye-bye.
Micheline. Well, Micheline Dianatola didn't get into the workshop. Well, checking the number, I mean, she could be from Santa Cruz. Well, let me, I forgot something. Doesn't matter. For tomorrow. Let's wait for 5 minutes more if she doesn't get inside. Anyway. What is this? Okay, I finished with this. I had 12 students registered on this workshop. I did one. And one student that was writing down to me by WhatsApp, but now I have no answer from here. Amilcar Pineda, I'm sorry. I was sending you messages from to WhatsApp to the internal channel, but I have no answer, please. Well, anyway, let's see tomorrow night at 8 p.m. to the theoretical class, and then we are going to be organized for the next class. Bye, everybody. See you tomorrow.